Dr. Sharfstein, thank you so much, and we're just thrilled you could be with us with your FDA experience. I read carefully the reports over the weekend of the president and Dr. Fauci arguing about a malaria prescription which has not really been tested in its efficacy in curing this virus. Give us your thought as you saw that heated debate this weekend. What was the thought you had, Dr. Sharfstein?
Well, thanks for having me. When I saw that, I thought, here we go again. This has been more than a century for the FDA, for the Food and Drug Administration, trying to make the case that just because one patient may do well or a couple patients doesn't mean a treatment actually works. The most important thing is to do a good study so you can really understand whether it works, how much it works, in what patient population, at what point of the disease. That's how you get real progress, is to really understand treatment. So, this has been going on around cancer treatments, around other treatments for years, and now we're seeing it again. I certainly support what Dr. Fauci says, which is you really don't know until you do a study that allows you to figure out whether giving the drug causes a patient to get better.
How do you respond to the demarcation that the President of the United States makes between academics and doctors? Tell us this divide between the theory and the practice of academic medicine, of drug tests, and the application of it in the field, where he urgently wants to take the risk on this malarial cocktail.
Well, I think it's okay when there's no other treatments for doctors to try things. But in the end, doctors want more than just treatments to try. They want treatments that work. Patients deserve evidence, not just hope. And so it's really important to temper, expectations with reality, and to be doing studies and talking about the need for real data. So I think it's okay for doctors to be trying this or trying that. I mean, there are very few tools right now. But on the other hand, that should not detract from the urgent need, and we all should understand that things that we're trying, they may work, they may not work. We're really throwing things at the problem now until we have evidence that tells us what actually works.
Dr. Sharfstein, let's talk about that in a little bit more detail. Good morning, it's Guy in London. Where do you see the greatest progress being made right now in terms of therapies and vaccines to help us deal with this?
Yeah, I think my sense from talking to people is that it's probably not in the medications that the president has been promoting, and I hope that the studies bear out that those have some value. But I think the real progress right now that people are more excited about has to do with the immune therapies. That whether you can use, for example, the antibodies that people who have recovered from the coronavirus have made, take them out of their blood and give them to other people very early or even before they're exposed. And there's studies like that at John Hopkins and at other institutions in the United States. There's some promising data that has come out of China, but a lot more evidence is needed there too. So I'm hopeful, because so many people have recovered from the coronavirus, that they can be donors and other people can benefit. That would be a relatively short-term preventive therapy and treatment that could make a big difference. It could also point the way to monoclonal antibodies and other products that might have a meaningful impact in the relatively short term.
Doctor, what is your sense of the accuracy of the models that we're all spending so much time paying attention to in terms of predicting when we are going to see the peak in the number of cases?
I think that there's a little bit of a misunderstanding about this concept of a peak. And, I think people, for where we are now, there will be a peak. But the only reason it's peaking is because we have shut everything down. So I think some people think when you're on the other side of the peak, it just goes down and we can open everything back up again. But if the reason it's peaking is because we've shut everything down, as soon as we open things back up, it's going to go up. And so we have to use the time that we have, that we're buying, to strengthen our healthcare system, to get more protective equipment to healthcare workers, and to build a stronger public health response So we have another set of tools besides just shutting everything down.
Dr. Sharfstein, we're flattening the curve. It's been successful in certain geographies. There's no question about that. I think of, let's say, the Baltimore Orioles. They're going to have a big game here against the Boston Red Sox. They're going to pack Cal Ripken Field. No question about that. Is it going to be safe to go to a baseball game with all those people crammed in?
Well, certainly it's not safe at the moment. Oriole Park at Camden Yards is a wonderful ballpark, but I think people realize that health comes first. And, right now that's not possible. I think what's going to happen is we're going to have to, and I like this analogy that other people have made, maybe we flipped off the light on our kind of world very quickly, but when we turn it back on, it's going to be more like a dimmer switch. Absent a miraculous treatment or vaccine, we're going to have to move very slowly. We're going to have to make sure that we're not, having the cases surge so high that they put our healthcare system in jeopardy again. So I guarantee you it won't be baseball games or football matches that are going first. It's going to be send more people going to work, in particular industries, probably not bars and restaurants. So it's going to be, a slow increase, and we may have to dial it back. If you look at what Singapore has been doing, Singapore has, kept a number of things open. They have encouraged social distancing. They do not have large gatherings like, sporting events. And they've been using a very robust public health response to keep it in check, isolation, contact tracing, quarantine. But they recently had an increase in cases, so they've dialed up their social distancing. So I think it's going to be most likely a period where we're going, it's like a dimmer switch until we can really get the light all the way on.
Yeah. Dr. Sharfstein, let us turn to Johns Hopkins and public health. I look at it like infrastructure, where the nation has a tradition of being grievously underfunded. There's no question we've been that way when we look at this emergent moment, this pandemic. What is the first order condition to better public health in America?
Well, first, we need people. Public health in the United States has lost more than 50,000 workers over the last decade or so. It's been very underfunded and neglected. It's very important that, particularly now, urgently, there are people to do some of the core public health tasks. We're going to need partnerships because even with more people, we still won't have the reach. So we're going to really have to have the private sector mobilized behind public health in different areas, provide resources like hotel space and dorms for people to stay when they're sick. And I think, for the future, we're going to need to rethink our priorities. We have so little attention paid to prevention of different kinds, including preventing the harm that a pandemic can cause.